So there's a question about, as I understand, bacteria are enemies in certain conditions, release toxins that can sometimes be harmful for us. What exactly are those toxins? Examples, name, composition. Like tetanus is a bacteria, Clostridia tetani, I think it's called, and it makes a tetanus toxoid, which can interfere with the ability of your neuromuscular connections to work, resulting in paralysis. Now, the interesting thing about that is that's the theory, and one evidence in favor of that theory is if you take pure tetanus toxin, and you inject it into a person, I'm not sure how, maybe intravenously, you can kill them through paralysis. Botulism is another Clostridia toxin. Now, that would lend credence to the idea that the paralysis from tetanus is due exclusively to this tetanus toxin getting released through the metabolism of the Clostridia in an anaerobic environment that's without air in your tissues. So if you have a wound and there's no air getting in, which is the sort of non-bleeding puncture wound, then you get these bacteria that then create this toxin, which gets into your bloodstream, and that creates the paralysis, which we call tetanus. So the evidence in favor of that, as I said, is that you can take this pure toxin. So now we're doing actually proper science. So we're trying to find out what part of that mess, is it the bacteria? Is it something they make? Is it tissue damage? Is it fear? Is it pain? Is it something? So let's isolate just one factor, in this case, the tetanus toxin, inject that into an animal, say, and they get paralyzed and die. Okay, we've got proof. The problem with that proof is you've also you've introduced a system which never really happens in real life. In other words, in 37 years of doing medicine, nobody came to me and said they were fine, and then somebody took a needle and injected it right into their veins or their tissues with this toxin, and then they got sick, and what do you think happened? And so as far as I know, that never happens. So that may seem like an insignificant problem, and it may be a problem which is hard to surmount with experimentation, because how else are you going to get that toxin in? But you have to be clear that injection of a toxin is not the way that we get exposed to toxins. And it also brings up the question of, might there be something attached to the toxin which is a cofactor or is necessary for it to work? Now, again, you could try to deal with that question by just getting an absolutely pure toxin and seeing if that works. But the reason I bring this up is because, as I've also pointed out before, according even to the CDC, in people who have clinical tetanus, in other words, paralysis, I think the vast majority, if not all of them, you cannot find this tetanus toxin anywhere in their body. Now, that should make everybody suspicious that there may be more to this than just an exposure to a toxin. There is, however, another explanation, which is the toxin gets metabolized so quickly, which is possible, and that's why you can't find it. So it's not that it's not there, it's just being metabolized or gotten rid of so quickly, or binding to certain proteins or enzymes or tissues, that you just can't find it, even though it actually is there. But that throws some doubt on it. The other doubt on it is that the idea of a tetanus shot is that they give you this toxin mixed with other things, and then you make antibodies, and the antibodies bind with the tetanus toxin and therefore protect you against tetanus. We know, however, that that's not true. In fact, the CDC also says in their tetanus page, you cannot go by a person's antibody levels to figure out whether they're suffering from from tetanus. So like an ER doctor, if somebody comes in and they're paralyzed and you don't know why, and you do a tetanus antibody assay and it's negative, they're telling you that you cannot therefore conclude the person doesn't have tetanus, nor if they have antibodies, can you conclude that they do have tetanus. In other words, the presence or absence of a tetanus antibody is completely worthless as far as a diagnostic tool. And again, I've mentioned this before. One of the reasons they got this is because there was a case study, and I don't remember the journal, but I talked about it a while ago, where they took somebody who was what they call hyperimmunized. In other words, they gave them, many, maybe even 100 tetanus shots so that they would make so many antibodies that they could then harvest the antibodies. And if somebody came in with tetanus, they could give just the antibodies, and because they didn't have time to wait for you to make the antibodies yourself, and that would bind with the toxin and keep the person from dying. So all sounds good, except what happened is the guy died from tetanus, even though he had thousands of times high level of antibodies compared to normal. So they concluded that even that high a level of antibodies was not protective against tetanus. So it makes the whole thing a little bit less clear that it's not just a toxin made by a bacteria, although there is some evidence that that is at least part of the story. So there's that one, there's botulism, there's probably some other ones.